Today, we're going to talk about something that's so important for our kids' health, a condition called rickets. We're going to break down what it is, how you can spot it, and most importantly, how to fix it with some steps that are, believe it or not, surprisingly simple.
You know, it often just starts with that one observation, that one little worry. A parent put it into words perfectly. "Sir, my child's legs are bowing outwards, and he seems so weak when he tries to walk." That single sentence, man, it really gets right to the heart of what we're talking about.
So what is rickets exactly? Well, simply put, it's a condition in children that causes their bones to become soft and weak. And the main reason this happens? It usually comes down to a lack of two really crucial things: vitamin D and calcium.
Okay, so what are those warning bells? How can you tell if this is something you need to look into? Let's walk through the key symptoms you should be aware of.
The biggest, most common sign of rickets is something called bow legs. And it's pretty much what it sounds like. It's when a child's legs curve outward, kind of like an archer's bow. It is the classic textbook symptom.
But hey, it's not just about the legs. There are a few other physical signs to keep an eye out for. You might notice their wrists look a little wide, or you might feel some small bead-like bumps along their rib cage. That's sometimes called a Rachitic Rosary. Other big clues can be a delay in learning to walk, or just noticing that the child's height isn't quite keeping up with their friends.
Now, if you're seeing any of these signs, the next step is pretty clear: a visit to the doctor. Let's look at how they figure this out for sure. And trust me, the process is actually really straightforward.
A doctor usually uses a simple two-step process to get to the bottom of it. First, they'll do a blood test. That's to check the levels of vitamin D, calcium, and a particular enzyme. Then, they'll often take an X-ray, usually of the wrist, because it gives a really clear picture of any weakness in the bones. That's how they can confirm it.
All right, now let's get to the good news, because there is plenty of it. Rickets is very, very treatable. The road to recovery is clear, and it really focuses on two main areas. The first part of the treatment is all about supplements. A doctor will prescribe vitamin D3, which typically comes as drops or a syrup, so it's super easy for a kid to take.
The second part is just as important, and it's all about what they eat. You see, the supplements work best when the child is also getting plenty of calcium-rich foods. That's what really helps rebuild that bone strength.
And listen, we're not talking about some complicated, expensive diet plan here. We're talking about simple, everyday stuff like milk, cheese, and eggs. Just getting more of these into your child's meals gives their body the building blocks it needs to get strong again.
But beyond the supplements and the food, there's one more thing, and it just might be the most powerful tool of all. Let's talk about the absolute best medicine, which, by the way, also happens to be totally free. And here's the magic number: 20. That's it. Just 20 minutes a day, out in the gentle morning sun. It can make an absolutely massive difference. Think about it. A simple, powerful prescription that doesn't cost a thing. So why does this work so well? It's because sunlight is hands down the biggest and most natural source of vitamin D on the planet. Our bodies are literally designed to produce it when sunshine hits our skin. It's like having your very own vitamin factory. So, let's just end on this thought. We often search for these complex solutions to our problems, but sometimes the most powerful medicine is also the simplest, and it's available to every single one of us for free. So the real question is, are you giving your child this free medicine every day?